Common baby feeding problems. Reflux. It's normal for babies to spit up a little, especially newborns. Babies' digestive systems are still developing. Babies can also get reflux, which is when food in the stomach backs up into the esophagus. To help manage reflux, try feeding your baby more slowly or feed him less at each sitting, loosen his diaper, and keep him upright after he eats for 20 to 30 minutes. Reflux almost always resolves without treatment by 12 to 14 months of age. Colic. As many as 2 out of 5 babies have colic, crying for hours at a time. Colic can start when a baby is 3 weeks old and usually goes away by the 3rd month. While colic won't affect your baby's appetite or ability to suck, a colicky baby may need some time to calm down before they eat, and they may be inclined to spit up a little once they do eat. However, call your child's doctor about vomiting, diarrhea, fever, weight loss, or blood or mucus in their stool. These are not symptoms of colic. Solids. According to the American Academy of Pediatrics, your baby may be ready for solid foods when he can sit by himself and reach for things to put in his mouth. To help your baby accept new foods, start with tiny portions. Also, try to make new food look similar to a familiar favorite. If he likes pureed carrots, try pureed sweet potato. Let your baby make a mess. At about 9 months, many babies start wanting to control feeding time and where they put their food. While it may be hard to sit back and watch the mess grow, be calm. This is an important step for your baby's learning, growth, and independence. Refusing food. You offer your little one a bit of food and she turns her head, swats at the spoon, or clamps her mouth shut. Babies refuse to eat every now and then for lots of reasons. They're tired, sick, distracted, or just full. Don't force feed your baby, but do talk to your child's doctor if you're worried. Jarred baby food and stomach distress. Jarred baby food may cause stomach issues if you feed your baby directly from the food jar and save the leftovers for another meal. Doing that can introduce bacteria from your baby's mouth into the food where it waits until the next time your baby eats it. When a baby eats the leftover food, it can lead to tummy trouble such as vomiting, diarrhea, and other symptoms. Foods to avoid. A baby's undeveloped gastrointestinal system can't deal with some foods that an adult's body can. Honey, in the first year of life, for example, may lead to infant botulism, which can be fatal. Always steer clear of chunky foods that pose choking hazards such as popcorn, hot dogs, raw fruits and veggies, raisins, and meat or cheese chunks. Avoid honey, cow's or goat's milk, or eggs until your baby is 1 year old. How about picky eaters? While picky eating may linger for weeks, even months, it rarely lasts. Your baby can become a picky eater for lots of reasons. When babies aren't feeling the best, like when teething, familiar foods provide comfort. Or maybe your baby just isn't ready to try a new food. Make sure you don't give your baby junk food just because that's all he wants. Offer healthy foods and a hungry baby will eventually eat them. Older babies and junk food. Sometimes mom and dad may be the source of baby's feeding problem. There's a temptation to give older infants the same foods you're eating, but that's never a good idea if what you're eating is junk food. Start giving babies sweet, salty, or fatty foods now, and it'll be hard to break your child's unhealthy eating habits when she's a toddler. Food allergies and intolerances. Up to 8% of children have food allergies. Symptoms such as rash, diarrhea, vomiting, or stomach pain can show up suddenly. Milk, nuts, eggs, soy, wheat, and shellfish are the most problem foods. Food intolerances are more common than allergies and may cause gas, bloating, and belly pain. If you suspect a food allergy, work with your child's doctor to find safe foods. When to get a pediatrician's advice. Because so many things could be causing your baby's feeding problems, it's a good idea to talk to your doctor if you're worried. Always call your child's pediatrician right away if your baby is losing weight, if he gags or vomits when he has certain foods, if you suspect diarrhea, dehydration, or constipation, or if you think he has reflux. You shouldn't feel shy about talking with your child's doctor if you have any questions or concerns.